Let's go over the full scoop on testosterone replacement therapy. So, are you looking to unlock the secrets of hormone therapy? Well, look, there aren't any. So, whether you're curious about its benefits, side effects, or how it can transform your life, you're in the right place. We're going to dive deep into the world of hormone therapy. We're going to explore everything you need to know to make an informed decision about your health and well being. So, stick around to the end to see some fantastic results from fellow men who have been on HRT. Today, we're going to be discussing TRT, testosterone replacement therapy, for everyone out there and answering all the questions you've ever had. I'm going to talk about how it works, what it does inside your body, how to know if you're a good candidate, what the treatment options are and what they look like, what the results are, how much it costs, and what the side effects are. The chapters of this video are in the description in case you wanted to skip to anything, so don't forget to like and subscribe for more content like this. And let me know in the comments, what's your opinion of TRT? Would you ever get it? Have you gotten it? How do you feel on it? Why or why wouldn't you get it? I'd love to hear your thoughts and help clear up any confusion you might have about HRT. So how does HRT work? Hormone replacement therapy, or HRT, for men, also known as TRT, or testosterone replacement therapy, involves the administration of testosterone to address low levels of this hormone specifically in the body. Here's how it works. Usually, you will come in and you will start with an assessment. So before starting any HRT, a healthcare provider is going to conduct a comprehensive evaluation. This usually includes blood tests to measure testosterone levels and assess many other health factors at the same time. Number two, once your blood levels come back, we're going to talk about treatment options. Testosterone replacement therapy can be administered through injections, patches, gels, creams, and even pellets implanted under the skin. So the choice of treatment depends on factors such as patient preference, lifestyle, and medical history. At Genesis, we usually focus on injections, creams, and pellets. Number three, increasing your testosterone levels. So the goal of HRT for men is to increase testosterone levels in the body to a normal and optimal range. This can help alleviate symptoms associated with low testosterone levels, such as fatigue, reduced libido, erectile dysfunction, decreased muscle mass, and mood changes at the same time. Once you're on TRT, we want to make sure that you are being monitored. So once treatment begins, our patients typically undergo regular monitoring to assess the effectiveness of therapy and adjust the dosage if necessary. So usually we start with your testosterone, we get blood work before then. Then after we've started, we'll check blood work 4 to 8 weeks later. Then we will consistently check blood every quarter to 6 months. You should at least get blood work done every year to make sure your testosterone levels remain within the target range and to monitor for any potential side effects. If a testosterone treatment company is not checking your labs or reviewing your labs, make sure you run away. You want to make sure that what gets measured is managed. And if they're not measuring your testosterone levels, they don't know how well the testosterone is working. How do you know otherwise how the testosterone is working and what are the benefits? Well, testosterone replacement therapy can offer several benefits for men with low testosterone levels, and that includes improved energy, enhanced libido, improved sexual function, increased muscle mass, strength, and improved mood and overall well-being. There's also studies that improves your immune system as well as reduces mental illness such as anxiety and depression. So what are some of the risks and considerations? So HRT can be beneficial for most men. It's essential to always talk about the side effects. Acne, fluid retention, breast enlargement, increased risk of cardiovascular events in some cases when the testosterone is overdosed. Therefore, we always make sure that treatment is individualized based off your assessment, your history, and we monitor you very closely. Overall, HRT for men aims to optimize testosterone levels to improve symptoms and quality of life for those experiencing low T. It's important to discuss the potential benefits and risks of treatment with your healthcare provider to determine if HRT is right for you. So, how do you know if it's right for you? Well, let's go over how you can tell whether or not you're a good HRT candidate. So determining whether someone is a suitable candidate for TRT involves a thorough evaluation by a healthcare provider. you want to make sure you get blood work done as well. So here are some of the factors that may indicate whether TRT is appropriate for you. Number 1, your blood work shows low testosterone levels. The primary indication for TRT is low testosterone levels, confirmed by blood tests. So symptoms of low testosterone such as fatigue, reduced libido, erectile dysfunction, decreased muscle mass, mood changes may also prompt testing, but you want to make sure you are tested. Number 2, what are some of the symptoms of testosterone deficiency? So a lot of times individuals experiencing symptoms associated with low testosterone blame it on other things: stress, issues with work, my children. These are all things that can also cause fatigue, low libido, erectile dysfunction, reduced muscle mass and strength, decreased body fat, mood changes, and decreased bone density. However, you want to make sure you're ruling out low testosterone and you're not just accepting it as a lifestyle issue. Number 3, your medical history. So a comprehensive medical history review is essential to assess for any underlying health conditions that may impact testosterone levels or the safety of TRT. So hypogonadism, pituitary disorders, obesity, diabetes, chronic illness, these all can lead to low testosterone levels. So can stress, depression, anxiety, and many of the garbage foods that we eat every single day. Number 4, a physical exam. Sometimes a physical exam may reveal signs of testosterone deficiency, such as decreased muscle mass, increased body fat, and decreased hair growth. This is why we always do an in-body assessment whenever you come into any one of our clinics. It can also help identify any underlying conditions that may need to be addressed before initiating TRT. So what are some of the risk factors of TRT? Look, in the studies, the risk factors are prostate cancer, breast cancer, severe sleep apnea, severe heart failure, but most of these issues are when you are overdosed. This is why, again, we make sure we monitor you very closely. And if you have a history of these diseases, you may not qualify for TRT, or with clearance, you may need careful monitoring. That's why you want to choose a physician or provider partner who's going to work with you the entire way. Ultimately, the decision to initiate TRT should involve a shared decision-making between the patient and your healthcare provider. So this process includes discussing the potential benefits, risks, alternatives to TRT, as well as addressing any concerns or questions that you might have. So what does the actual treatment or procedure look like, and how many times or how often do you have to do it? Well, the treatment regimen and frequency can vary depending on the type of formulation of testosterone used, the individual response to therapy, but usually here's kind of an overview of the general methods. Number 1, most common is injection. Testosterone injections are one of the most common methods of TRT. Usually injections are administered intramuscularly into the butt, glute muscle, or the thigh muscle, or the shoulder muscle. The frequency injection can vary, but it's usually once every 1 week to every 3 to 4 days. Testosterone has a half-life of about 5 to 7 days. So after 7 days, it usually drops off. The number 1 issue I see with many healthcare providers is that they'll give 1 testosterone injection a month or 1 testosterone injection every 2 weeks. And usually that is not often enough to really make sure your testosterone level gets back up to optimal. So if you find those clinics, run away from them. So some individuals may require injections more frequently to maintain stable testosterone levels. Myself, for example, I need the same dose of testosterone just split in half twice a week instead of once a week, because I end up actually metabolizing the testosterone faster than others. Again, we will know that once you start to get treated, or your provider will know that once you start to get treated. One of the other ways that we don't really recommend is called transdermal patches. So testosterone patches can be applied to the skin, and they deliver testosterone directly through the bloodstream with absorption. Patches are usually applied to a clean, dry skin on the abdomen, back, thighs, or upper arms, and they're worn for a specific period, usually 24 hours. So depending on the formulation, the patch may need to be changed daily or every few days. Number 3 is a topical gel or a cream. So testosterone gel or cream can be applied to the skin, typically on the upper arms or shoulders or abdomen, where it won't rub off on somebody else. The gel or cream is then absorbed through the skin, delivering testosterone into the bloodstream. The application frequency depends on the specific product, but is typically once daily. Another way that it can be delivered that we don't do is is called buccal tablets. So buccal testosterone tablets are placed between the gums and the cheek, where they dissolve and release testosterone into the bloodstream through absorption into the oral mucosa. The tablets are usually taken twice a day. That's usually why it fails. In the morning and the evening, because nobody has time for that, and we don't recommend it. Number 5, pellets or implants. So testosterone pellets are small, tiny, they look like rice granules made of testosterone inserted under the skin in the buttocks or lower abdomen of the back with a minor surgical procedure. This is usually done on a local anesthetic. Super easy, feels like a bee sting, then you don't feel anything. And the pellets gradually release testosterone over several months, usually 4 to 6 months, providing a long-acting form of TRT where you don't have to remember the cream or the injections or the pellets or anything like that. So the choice of TRT method and frequency of administration depends on factors including the individual's preference, lifestyle, treatment goals, response to therapy, and the provider's expertise. So regular follow-up appointments and blood tests are always typically conducted to assess testosterone levels and adjust treatment as needed. Again, if you're going to a doctor and they do not do follow-up blood work or follow-up tests to see how your testosterone is doing often, then you need to stop seeing that provider. So what are some of the results you can expect from TRT? Well, testosterone replacement therapy can lead to a range of benefits for individuals with low T levels. The specific results and improvements experienced can vary depending on the factors such as your age, your health, baseline testosterone, and adherence to treatment. So some of the potential results and benefits of HRT include, number 1, increased energy and vitality. So many individuals will report feeling more energetic, motivated, less fatigue after starting TRT. So this improved energy levels can lead to increased productivity and engagement in daily activities, increased amount of going to the gym and exercising, which will all help produce more testosterone. Usually testosterone takes about 2 to 3 weeks to start to improve your health and wellness, and really 4 to 6 weeks to really get up to a level where you feel peak success. Pellets might take longer than that. Number 2, improved mood and well-being. The number 1 issue that I have seen in gentlemen and ladies between the age of 35 to 45 is they all have some sort of midlife crisis. And midlife crisis is usually not from something external. It's actually from your hormones starting to drop off significantly, specifically testosterone. And when you have low testosterone, you feel depressed. You have more of that midlife crisis. And if more people checked their testosterone levels at this age, there would be a lot less people on Prozac, Lexapro, other types of anti-anxiety medications, and a lot less anxiety and depression. So TRT may help alleviate symptoms of depression, irritability, and mood swings associated with low T. So some individuals experience even enhanced overall well-being and a more positive outlook on life. I mean, what is not to love about that? Number 3, we are going to pump you up. So increased muscle mass and strength. Testosterone plays a crucial role in muscle development and maintenance. So with TRT, individuals can experience gains in muscle mass, strength, and physical performance, particularly when combined with regular exercise and strength training. There's a reason why it is banned by the Olympics, because it can improve all those things. Number 4, fat loss and body composition changes. So testosterone significantly influences fat metabolism and distribution in the body. The more testosterone you have to a degree, the easier it is for your metabolism to reduce body fat, particularly in the abdomen, and improve your body composition. So make sure if you're trying to lose weight, you also consider not just taking your weight loss medications, but getting your blood work done to see if testosterone levels and hormone levels in general are contributing to your issues with weight loss. Number 5, improved bone density, the thing you cannot see. So testosterone contributes to bone health and density. So TRT can help prevent bone loss and reduce the risk of osteoporosis and fractures, especially in older individuals. And number 6, perhaps the most important, enhanced libido and sexual function. Testosterone is essential for maintaining sexual health and function in both men and women. So TRT may lead to improvements in libido, erectile function, overall sexual satisfaction, all of the above. it is good for you. Number 7, cognitive benefits or clarity. So there's research that actually shows TRT can have positive effects on cognitive function, including improved memory, improved concentration, improved cognitive processing speed, and particularly this is prevalent in older adults with low testosterone levels. So make sure as you get older, your testosterone is optimized as much as possible. Cardiovascular health. So while the effects of too much TRT can cause issues with cardiovascular risk, TRT can also improve cardiovascular risk factors such as cholesterol levels, blood pressure, insulin sensitivity when used in proper doses and proper amounts. So how much does TRT cost? Well, the average cost of testosterone replacement therapy can vary widely, depends on factors such as the type of medication, the dosage, the frequency, the administration, where you are in the United States. So on average, I couldn't give you an idea of specifically what you are going to have to pay. However, when you are considering TRT and you're considering improvement in health, wellness, immune system, libido, sleep, energy, clarity in your mind, I mean, what does it matter what the cost is? It matters that you get the treatment that you deserve and you live the best life you possibly can. So what are the side effects of TRT? Testosterone replacement therapy can have various side effects, although not everyone experiences it, and their severity can vary from person to person. So some of the potential side effects are, number 1, acne. Increased testosterone can lead to an overproduction of oil in the skin, which may result in acne breakouts. Usually this happens right at the beginning when you're starting testosterone. However, if you're starting testosterone at a low level and slowly increasing, the acne usually goes away. It's those guys that take way too much that you see head to toe breaking out in acne, or they're taking bad or what's called bunk testosterone made out of somebody's basement, has fillers and garbage in it. That's what's going to cause that gross acne all over the body and cystic acne. Number 2, fluid retention. So some individuals can have fluid retention where they have swellings in the hands, feet, or ankles. Again, this is usually very short-lived and goes away. Number 3, breast enlargement, also known as gynecomastia, male boobies. So TRT can cause this from the development of breast tissue in men, and this is usually when testosterone therapy is either too much or the patient what's called aromatizes testosterone. So testosterone through aromatization turns into estrogen, and estrogen can increase breast tissue in men, estradiol levels. So sometimes if a male has that issue, we lower their ability to aromatize with aromatase inhibitors. But not everybody should use this from the beginning. There's usually only about 25% of men that require this. Starting testosterone at a low dose and moving slowly up, estradiol and other estrogen and progesterone levels should be checked while you're getting your testosterone level balanced to make sure that all of this is playing very well into what our goals are and what your goals are. Number 4, worsening sleep apnea. So TRT can worsen obstructive sleep apnea. So that's a condition characterized by interruptions in breathing during sleep. So make sure you're paying attention to that if you do have it. Number 5, testicular shrinkage. So exogenous testosterone supplementation. So that's, again, the injections, the pellets. Exogenous is not from without. That is taking testosterone supplements. This can actually suppress the body's natural production of testosterone. And if you suppress the body's natural production of testosterone, it's going to tell the negative feedback loop in your testes to stop producing sperm. And if you stop producing sperm, you're going to potentially shrink your testicles. So make sure if you still want to have children while you're on testosterone therapy, you talk to your doctor about treatments that can help with the natural production of testosterone as well as help preserve testicular size, such as HCG or enclomiphene, both medications that can help combat the side effect of testosterone. Number 6, increased risk of blood clots. So testosterone therapy can increase the risk of blood clots, especially in individuals with a history of blood clotting disorders or cardiovascular disease. So always make sure you're getting cleared from your doctor if you have those issues. Number 7, changes in cholesterol levels. So TRT can affect cholesterol metabolism, leading to changes in cholesterol levels, including increases in LDL and decreases in HDL. However, this is usually mild and minimum. Number 8, like we talked about, decreased sperm count. So testosterone production suppresses sperm production, potentially leading to infertility in men. So make sure you're taking medications to combat this if you ever want to have children children. Again, HCG and enclomiphene are great choices for that. Number 9, mood swings. We all like testosterone rage, so some individuals may experience mood swings, irritability, and aggression while on TRT. Usually this is a result, again, of overdosing TRT. At the beginning, you might feel a little bit of this, but usually it will balance out once your body gets used to it. So pay attention to that. Number 10, increased risk of cardiovascular events. So we talked about before, there is evidence that it can increase possibly cardiac events. However, these patients usually have pre-existing cardiovascular risk factors when they're trying to take TRT, which causes sometimes thickening of the blood and increases the risk. So usually it has minimal adverse effects, so anyone considering TRT should discuss the potential risks and benefits with their healthcare provider and undergo regular monitoring to ensure their safety and well-being. Now, to really show you the effectiveness of TRT, here are some crazy before and after photos that we're gonna put up on the screen that people posted for their testosterone transformations. And there you have it, your in-depth guide to TRT. If you still have any questions or concerns, comment them below. I'd be happy to answer them. Interested in exploring TRT for yourself? Click the link in the description to book a consultation with one of our experts. Don't forget to like and subscribe. We'll see you next time.